Hello, am I audible?
Yes, sir.
As a Twitter topic, so we'll be talking about plastic anemia as well as megaloblastic anemia. So, can you see the slide?
Yes, sir. देखिरहेछ.
So today we'll be talking about aplastic anemia or pancytopenia. So as you can see in the figure, there is decrease in red blood cell, white blood cell, as well as platelets from the bone marrow. Right? So you can see in the bottom left corner, you can see bone marrow biopsy. So pancytopenia. So you can see decrease of marrow, right? Hypoplastics of marrow. So in this picture, you can see normal blood cells and aplastic anemia cells. So you can see in the left corner, you can see normal blood cells. So there are lots of Can you hear me?
Yes, sir. Slide चाहिँ गयो सर.
Wait. So in this picture, you can see the normal blood cell as well as aplastic anemic cells. So WBC or देख्न सक्छ हैन, which fight against the infection, red blood cell which carry the oxygen, platelets which control the bleeding हैन. In aplastic anemia, all these cells are decreased. So the early referral diagnosis by bone marrow aspiration is mandatory in these cases. So early bone marrow transplant, it's the only clear. Most of the cases, तिम्रो bone marrow transplantation नै गर्नुपर्ने हुन्छ. So pancytopenia refers to a reduction below normal levels of all three peripheral blood lineages, such as leukocytes, platelets, and erythrocytes. So reduction below the normal value of all three peripheral blood lineages. So it can be constitutional or genetic. Genetic or acquired. So severe aplastic anemia भने चाहिँ total leukocyte count भन्नाले तिम्रो absolute neutrophil count हुन्छ है. Absolute neutrophil count चाहिँ कसरी निकाल्ने भने if the neutrophil percentage is 10 and total count चाहिँ 2000 छ भने 10 times 2000 divided by 100 गर्ने है, अनि तिम्रो चाहिँ absolute neutrophil count आउँछ. So 2 or more of this. So absolute neutrophil count is less than 500 per millimeter cube. Platelet count less than 20,000 and reticulocyte count less than 1%. Okay? Moderate aplastic anemia भने चाहिँ if the absolute neutrophilic count is 500 to 1500, platelet count चाहिँ 20,000 to 1 lakh भयो भने चाहिँ that is moderate aplastic anemia, and reticulocyte count is less than 1%. So constitutional or genetic causes of aplastic anemia are Fanconi anemia, Schwartzman-Diamond syndrome, dyskeratosis congenital, megakaryocytic thrombocytopenia, and other genetic syndromes such as Down and Noonan syndrome. Acquired causes are radiation such as drugs, chemicals, chloramphenicol, anti-epileptic drugs, pancytopenia, gold, and viruses such as CMV, hepatitis B and C, parvovirus, paroxysmal nocturnal hemoglobinuria in case of leukemia or autoimmune or mixed connective tissue disorder or SLE in our lepani, it's causes of pancytopenia. Acquired causes drugs, chemicals, viruses, अर्को चाहिँ तिम्रो युजुअली अटोइम्युन है अटोइम्युन भन्नाले तिम्रो एसएलईहरू हुन सक्छ है दैट माइट कज प्यानसाइटोपेनिया है अर्को चाहिँ हेरिडिटरी कजमा चाहिँ फान्कोनी एनिमिया स्वाचमान डायमन्ड सिन्ड्रोम dyskeratosis congenita or megakaryocytic thrombocytopenia or other genetic syndromes such as Down and Noonan. Can you hear me?
Yes, sir.
Okay. So identifying the etiology of pancytopenia requires microscopic examination of the peripheral blood smear as well as bone marrow biopsy and aspirate specimen to assess overall cellularity and morphology. So the three general categories of pancytopenia are related to bone marrow pathologies and can frequently be differentiated based on bone marrow findings. So number one is pancytopenia with hypocellular bone marrow. What are the diseases associated with it? Bone marrow biopsy hypocellular bone marrow. In those conditions, we have to suspect inherited bone marrow failure syndromes, such as Fanconi, dyskeratosis congenita, Schwarzman diamond syndrome, or hypocellular bone marrow chances body. अनि अर्को चाहिँ acquired aplastic anemia of varied etiologyहरू पनि हुन सक्छ है अर्को चाहिँ hypoplastic variant of myelodysplastic syndromesहरुमा भयो भने नि pancytopenia with hypocellular bone marrow हुन्छ अर्को चाहिँ pancytopenia with cellular bone marrow so cellular bone marrow भयो भने चाहिँ कुन डिजिज कन्डिसनमा हुन्छ भने acute leukemia myelodysplasia secondary to autoimmune disorders like autoimmune lymphoproliferative syndrome, SLE, vitamin B12 deficiency, folic acid deficiency, storage disease such as Gaucher's, Niemann-Pick, right? Or infections, sarcoidosis, hypersplenism, or pancytopenia with cellular bone marrow. Or pancytopenia with bone marrow infiltration. In this case, myelofibrosis or hemophagocytic lymphohistiocytosis and osteopetrosis. Hemophagocytic lymphohistiocytosis is macrophage activation syndrome. So pancytopenia with bone marrow infiltration, pancytopenia with bone marrow or cellular bone marrow or hypocellular bone marrow. So you have to look for, and according to that, you have to send investigations, right? So you take normal bone marrow biopsy, you can see over here cells or and in this you can't see cells. So etiology might be chemical damage, immune destruction, or genetic defects. So now coming to the most common cause of constitutional aplastic anemia or pancytopenia. So Fanconi anemia is a rare multi-system hereditary disorder resulting in development of bone marrow failure in those affected, and there is predisposition to malignancy, including myelodysplasia, acute myeloid leukemia, and epithelial cancers. The individual with Fanconi anemia often have congenital malformation and they are highly sensitive to alkylating agents and radiation. So there is autosomal recessive, it might be autosomal recessive or X-linked recessive. So at presentation, there might be physical anomalies as well as hematological anomalies. In majority of patients, physical or hematological anomalies. Normal physical but abnormal hematological anomalies. So you 1/3 patients. Physical anomalies and physical anomalies normal hematological findings. Fanconi anemia. Different 3 types of presentation. The most common one is typical physical anomalies with abnormal hematological findings. So the patients with Fanconi anemia have faulty DNA repair and there is increased chromosomal fragility caused by DNA interstrand cross-linking agents such as deoxybutyn or mitomycin. In your chromosomal there is that can lead to chromosomal fragility. So the clinical features are there is absence of radii or thumbs that are hyperplastic or supernumerary, bifid or absent. Right. So anomalies of feet can be there. So congenital hip dislocation and leg abnormalities can also be seen. Or skin hyperpigmentation, such as in trunk or neck or intertriginous areas, such as cafe olive spots or vitiligo. Or short stature हुन सक्छ, right? There might be underdeveloped penis, undescended atrophic absent testis, hypospadiasis or phimosis, and most of them are infertile. So female can have malformations of vagina, uterus, and ovary, and all have reduced fertility. So many patients have characteristic facial dysmorphism, including microcephaly, small eye, epicanthal folds, and abnormal shape, size, or positioning of the ear. Kidney may have ectopic pelvic or shaped dysplastic kidneys. Right? Cardiovascular or gastrointestinal malformation also can occur. So approximately 10% of patients with Fanconi anemia are cognitively delayed. Neonates with Fanconi anemia usually have IUGR and low birth weight and may show malformation consisting with bacterial or bacterial H. So that stands for vertebral anomalies, anal atresia, cardiac malformation, tracheoesophageal fistula, esophageal atresia, renal and limb structural abnormalities with hydrocephalus. So this is the picture showing Fanconi anemia. So it's 3-year-old boy with Fanconi anemia who exhibit several classic phenotype. So in picture A, you can see the microcephaly, है microcephaly हुन्छ micronactia छ हैन epicanthal folder हुन्छ. In picture C you can see supernumerary fingers and thumbs are attached by a thread. In picture D you can see cafe olive spots, or there is a hypopigmented patches as well, right? These are the short stature पनि छ यो बच्चाको, है. So this is a feature of Fanconi anemia. So Fanconi anemia should be considered in all children and young adults with unexplained cytopenia. So abnormal hematological findings and characteristics, physical anomalies suggest the diagnosis. So which is confirmed by chromosomal study. यो चाहिँ हामीले DB र मिटोमाइसिन C बाट चाहिँ गर्न सक्छ. यो chromosomal breakage study चाहिँ we have to do in case of Fanconi anemia. So treatment, so एउटा चाहिँ hemopoietic stem cell transplantation भयो, that should be allogenic and HLA matched हुनु पर्यो, है. अर्को चाहिँ androgens such as oral oxymethylone or danazole, है, can be used. अर्को चाहिँ granulocyte colony stimulating factor, हैन, के गरी neutropenia छ भने you can use granulocyte colony stimulating factor हरु चाहिँ हामीले युज गर्न मिल्छ. अर्को चाहिँ तिम्रो androgenic drugs such as danazole, है, नेपालमा चाहिँ danazole हरु पाउँछ. अर्को oxymethylone, अर्को चाहिँ hemopoietic stem cell transplantation can be done in case of Fanconi anemia. Now अर्को चाहिँ Schwartzman Diamond syndrome, यो चाहिँ autosomal recessive हुन्छ. So it is also associated with multi-system exocrine pancreatic insufficiency, skeletal abnormalities such as metaphyseal dysplasia. So Schwartzman Diamond syndrome is a ribosomopathy and there is a underlying defect in ribosome assembly. So this is the figure showing a Schwartzman Diamond syndrome. So there is exocrine pancreatic insufficiency, bone marrow failure, and growth retardation with skeletal defects. So major clinical features of Schwartzman Diamond syndrome are neutropenia. There might be severe neutropenia that is less than 500, anemia, thrombocytopenia, pancytopenia, exocrine pancreatic insufficiency, liver enzymes might be elevated, skeletal abnormalities, metaphyseal dystosis, rib cage anomalies, and short stature. So if there is hematological abnormalities with exocrine pancreatic insufficiency, then you should suspect Schwartzman Diamond syndrome. So Clinical manifestation are fat malabsorption from birth that are caused by pancreatic insufficiency. Approximately 50% of patients appear to exhibit an improvement in pancreatic enzyme secretion as they age. The clinical picture can be dominated by clinical complications from anemia, neutropenia, and thrombocytopenia. There might be bacterial and fungal infections secondary to neutropenia, neutrophil dysfunction, and immunodeficiency. So it also consists of short stature. The patients are short stature. There might be skeletal Can you hear me?
Yes, sir.
Yes, sir.
So, or metaphyseal dysplasia, osteopenia. There might be delayed appearance of secondary ossification center, short or मलाई फोन गरिरहेछ यो नम्बरबाट त्यो Can you see the screen?
Yes, sir.
So they may have neurocognitive problems as well, right? So there might be on laboratory examination, there might be reduced serum tryptanogen and pancreatic isoamylase level. Fecal elastase is often reduced. Fat soluble vitamin deficiency might occur. That might lead to prothrombin time increase, prothrombin time ultrasound or CT scan might visualize fatty replacement of pancreatic tissue. Okay, there might be neutropenia, which is severe, seen in 70% of the cases. Or anemia, thrombocytopenia, and pancytopenia is seen as 40 to 66% of the cases. Bone marrow biopsy specimen and aspirates may show bone marrow hypoplasia and fat infiltration. So diagnosis relies on having bone marrow dysfunction and exocrine pancreatic insufficiency. So treatment is oral pancreatic enzyme replacement, supplement fat soluble vitamins. We might need granulocyte colony stimulating factor for neutropenia in some patients with who receive androgen. So androgen र steroid पनि दिन मिल्छ यसमा. अर्को चाहिँ hemopoietic stem cell transplantation is the ultimate care. Now coming to acquired pancytopenia है मैले दुईटा चाहिँ most important Fanconi anemia र Schwarzman diamond syndrome चाहिँ most common causes of pancytopenia or aplastic anemia है यो चाहिँ हामीले it's very needed है. अर्को चाहिँ acquired pancytopenia. So clinical manifestation, laboratory findings, and differential diagnosis of acquired pancytopenia should be looked for, right? So pancytopenia तिम्रो hemoglobin पनि कम हुन्छ, that can lead to cardiac failure हैन के तिम्रो total leukocyte count or severe neutropenia infection हुन सक्छ. अर्को चाहिँ severe thrombocytopenia that is less than 20,000 that can lead to bleeding, and if the hemoglobin level is less than 6, fatigue हुन सक्छ है, the patient might. So acquired pancytopenia is typically characterized by anemia, leukopenia, thrombocytopenia in the setting of elevated serum cytokine values. Other treatable disorders such as cancer, collagen vascular disorders, paroxysmal nocturnal hemolytic anemia, and infection that may respond to specific therapies like intravenous immunoglobulin in case of parvovirus should be considered in differential diagnosis. So careful examination of peripheral blood smear for RBC, leukocyte, and platelet morphology features is important. So a reticulocyte count should be performed to assess erythropoietic activity. In children, the possibility of congenital pancytopenia should be always considered. So in children, we have to consider congenital pancytopenia such as Fanconi anemia, right? So for Fanconi anemia, we have to do chromosomal breakage analysis. So in case of fetal hemoglobin, congenital pancytopenia should be considered, right? But it's not a diagnostic. But if there is fetal hemoglobin, then we have to suspect congenital pancytopenia. To assess for PNH, that is paroxysmal nocturnal hemoglobin urea, flow cytometry analysis of CD, CD55 and CD59 is the most sensitive test. And bone marrow examination should be include both aspiration and biopsy, and the marrow should be carefully evaluated for morphologic features, cellularity, and cytogenetic anomalies. Right? So bone marrow aspiration पनि गर्नु पर्यो हैन, स्लाइड राख्नु पर्यो र biopsy पनि लिनु पर्यो है, and we have to evaluate for cellularity, morphologic features, cytogenetic abnormalities हरू पनि हेर्नु पर्ने हुन्छ. For treatment, the treatment of children with acquired pancytopenia requires comprehensive and supportive care coupled with an attempt to treat the underlying marrow failure. For patients with human leukocyte antigen match family donors, allogenic hematopoietic stem cell transplantation offers a 90% chance of long-term survival. Also, we can give cyclophosphamide, fludarabine, horse antithymocyte globulin as well. अर्को चाहिँ यो स्टडी भइरहेछ छ, इन केस अफ सिभियर aplastic anemia we can give L-tuzumab, है, यो चाहिँ CD52 monoclonal antibody हो. So MAB भनेको चाहिँ monoclonal antibody. So L-tuzumab चाहिँ दिन मिल्छ इन केस अफ सिभियर aplastic anemia in acquired, है. अर्को patient without a sibling donor छैन भने the majority of therapy is immunosuppression with antithymocyte globulin and cyclosporine, and there is a response rate of about 70 to 80%, right? So this is यो चाहिँ acquired treatment भयो. अर्को चाहिँ अघि नै हामीले हेरेको चाहिँ त्यो चाहिँ constitutional or genetic cause of aplastic anemia. So अर्को चाहिँ we have अर्को topic चाहिँ we have megaloblastic anemia, है. So both are important, है. Megaloblastic important, megaloblastic anemia पनि important छ, aplastic anemia पनि important छ. So megaloblastic anemia मा चाहिँ so कति भयो भने चाहिँ megaloblastic भन्छ तिम्रो MCV, mean corpuscle volume कति भयो भने megaloblastic भन्छ? Can anyone say?
So 96 on the body.
Okay, so you can see हैन तिम्रो pentoliter भन्ने हुन्छ हैन. So if the MCV is more than 100 or है त्यो भयो भने चाहिँ we say megaloblastic anemia, है. So megaloblastic anemia you can see here तिम्रो nuclear यो के रे neutrophils हो, this multilobulated, more than 5 segments हुन्छ है. So तिम्रो यो अर्को सेलमा यो देख्न सक्छौ तिम्रो nucleus is more than the cytoplasm, है. यो चाहिँ megaloblastic anemia मा हुन्छ, किनभने यसमा चाहिँ तिम्रो DNA repair system चाहिँ impaired हुन्छ है, in case of megaloblastic anemia due to folate or B12 deficiency भयो भने चाहिँ megaloblastic anemia हुन सक्छ. So megaloblastic anemia describes a group of disorders that are caused by impaired DNA synthesis. So RBC are larger than normal. So MCV is more than 100 pentoliter at every developmental stage, and there is maturation asynchrony between the nucleus and cytoplasm of the erythrocyte. So the picture ma dekhne हैन तिम्रो nucleus यो picture मा चाहिँ so यसमा चाहिँ nucleus र cytoplasm asynchrony हुन्छ. So there is often associated with thrombocytopenia and leukemia, है. Most commonly B12 deficiency मा चाहिँ तिम्रो thrombocytopenia with leukemia पनि हुन्छ. The peripheral blood smear is notable for large oval RBC with increased mean corpuscular volume. So neutrophil is characterized by hypersegmentation हुन्छ है. Neutrophils का more than 5 lobes हुन्छ. Most cases of childhood megaloblastic anemia result from deficiency of folic or B12 or cobalamin deficiency, which are essential for DNA synthesis. Rarely, this anemia can be caused by inborn error of metabolism, like in orotic acid ureas. Timro orotic acid urea timro macrocytic or megaloblastic anemia also. So this is the diagram showing the synthesis of DNA synthesis with the help of folate as well as B12. So with the help of dihydrofolate reductase, त्यसले चाहिँ तिम्रो फोलेटलाई चाहिँ टेट्रा हाइड्रोफोलेट रिडक्टेसमा गर्छ है अनि तिम्रो टेट्रा हाइड्रोफोलेट रिडक्टेस चाहिँ विथ द हेल्प अफ B12 5 मिथाइल टेट्रा हाइड्रोफोलेट हुन्छ त्यो चाहिँ 5 to 10 मिथाइलिन टेट्रा हाइड्रोफोलेट हुन्छ दैट इज रिक्वायर्ड फर डीएनए सिन्थेसिस अर्को चाहिँ तिम्रो होमोसिस्टिनबाट मिथियोनिन हुनलाई चाहिँ B12 चाहिन्छ सो इन केस अफ B12 deficiency चाहिँ usually तिम्रो मिथियोनिनमा कन्भर्ट हुँदैन which is required for methylation of proteins and DNA है त्यो जुन चाहिँ यो SAM भन्छ है त्यो मिथियोनिनबाट सो होमोसिस्टिन चाहिँ एलिभेटेड हुन्छ इन केस अफ B12 deficiency है अर्को पनि यहाँ छ है you can see here so तिम्रो मिथाइल कोबालामिन चाहिँ चाहिन्छ है for conversion of होमोसिस्टिन टु मिथियोनिन है अर्को पनि तिम्रो मिथाइल म्यालोनाइल कोए भन्ने हुन्छ है दैट इज चेन्ज टु तिम्रो सक्सिनाइल कोए यसमा पनि तिम्रो कोबालामिन चाहिन्छ है मिथाइल कोबालामिन चाहिन्छ सो इन केस अफ फोलेट डेफिसिएन्सी तिम्रो होमोसिस्टिन इन केस अफ फोलेट एज वेल एज B12 डेफिसिएन्सी होमोसिस्टिन चाहिँ इन्क्रिज हुन्छ तर तिम्रो B12 डेफिसिएन्सीमा चाहिँ मिथाइल म्यालोनाइल कोए पनि इन्क्रिज हुन्छ है यसमा चाहिँ मैले यो देखाउन खोजेको बट इन केस अफ फोलेट डेफिसिएन्सीमा चाहिँ ओन्ली होमोसिस्टिन चाहिँ इन्क्रिज हुन्छ तर मिथाइल म्यालोनाइल कोए चाहिँ नर्मल हुन्छ सो कजेस अफ RBC macrocytosis है सो मेगालोब्लास्टिक एनिमिया चाहिँ तिम्रो कोबालामिन डेफिसिएन्सी हुन्छ folate folic acid deficiency the antifolate drugs such as methotrexate right it inhibits tetrahydrofolate reductase right sorry dihydrofolate reductase antifolate also cytotoxic drugs such as hydroxyurea 5-fluorouracil azithromycin right that can lead to megaloblastic anemia so the accompanying hematological features are megaloblastic changes including hypersegmented neutrophils, macrocytosis can be severe. There might be mild reticulocytopenia and pancytopenia when the megaloblastic process is very severe. So these are the causes of disorders of erythroid production in case of aplastic anemia, Blackburn diamond syndrome, sideroblastic anemia that might produce megaloblastic anemia. Right? So drugs such as alcohol, some antiviral drugs right, can lead to megaloblastic anemia or non-hematological disease such as chronic liver disease, hypothyroidism, copper deficiency, or severe hyperglycemia, hyponatremia can lead to megaloblastic anemia. Now coming to folic acid deficiency, so folates must be reduced to tetrahydrofolates in a process catalyzed by the enzyme dihydrofolate reductase है त जो मैले अघि नै देखाइसके हैन tetrahydrofolate बन्नलाई we need an enzyme dihydrofolate reductase which is inhibited by methotrexate right? So that's why during when we keep methotrexate कुन disease condition मा हामीले methotrexate चलाउँछ
ulcerative colitis, Crohn's disease.
Okay, Crohn's, ulcerative colitis, and DMARDs so rheumatic arthritis, juvenile idiopathic arthritis, or even in cancers, leukemia, or methotrexate. So we have to give folate if we give patients methotrexate. Okay, as such, they're essential for DNA replication and cellular proliferation. Like other mammals, human cannot synthesize folate and depend on dietary sources including green leafy vegetables, fruits, and animal organs such as liver and kidneys. Folates are heat liable and heat labile and water soluble. Consequently, boiling or heating folate sources leads to decreased amount of vitamin. So causes of folate deficiency are inadequate nutrition such as poor diet, poor food preparation methods. If we give only goat milk, folic acid deficiency अर्को चाहिँ deficiency in absorption such as gastric HCl decrease गर्ने ochlorhydria भन्छ. Disease such as small intestine disease, tropical screw celiac disease, dermatitis herpetiformis, inflammatory bowel disease, oral pancreatic replacement therapy, hereditary folate malabsorption, increased requirements or losses that can be in case of pregnancy, lactation, prematurity, chronic hemolytic anemia, dialysis, and such as in case of chronic hemolytic anemia, thalassemia, sickle cell anemia. In those cases also we have to supplement folic acid, right? Hypothyroidism, Lyssnian syndrome, disorder of transport such as cerebral folate deficiency, disorder of cellular metabolism such as drug inhibiting folate metabolism such as methotrexate and cotrimoxazole use such as trimethoprim पनि तिम्रो folate metabolism लाई inhibit गर्छ, sulfasalazine, valproic acid, right? So clinical manifestation, in addition to clinical features associated with anemia, folate deficient infants and children may manifest with irritability, chronic diarrhea, poor weight gain. Hemorrhages from thrombocytomia may occur in case of advanced cases. Congenital folate malabsorption and other rare etiologies of folate deficiency may be further associated with hypogammaglobulinemia, severe infection, failure to thrive, neurological abnormalities, and cognitive delays. So you can see folate deficiency गर्दाखेरि चाहिँ spinal bifida र beefy tongue हुन्छ. So तिम्रो atrophy, तिम्रो यो tongue को papillaहरूको atrophy हुन्छ है त. That can lead to folic acid deficiency can lead to generalized epithelial atrophy of the tongue, and यो चाहिँ beefy tongue पनि भन्छ है. So laboratory findings मा चाहिँ anemia is macrocytic, so mean corpuscular volume is more than 100 femtoliter. So variation in RBC shape and size are common. Reticulocyte count is low. There might be nucleated RBC with megaloblastic morphologies are often seen in peripheral blood smear. Neutropenia, thrombocytomia may be present, particularly in patients with long-standing and severe deficiency. Neutropenia, thrombocytopenia. Neutrophils are large, some with hypersegmented nuclei. The bone marrow is hypercellular of erythroid hyperplasia and megaloblastic changes are prominent. Large abnormal neutrophilic forms, giant metamyelocyte and cytoplasmic vacuolation are seen. So normal folic acid levels are 5 to 20 nanogram per ml, with deficiency levels are less than 3 nanogram per ml deficient. So you can see here, nucleus or cytoplasmic ratios are different. You can see asynchrony, nucleus the ठुलो छ than the cytoplasm. Hypersegmentation of the neutrophils and तिम्रो cells पनि more than 100 femtoliters, right? So अर्को you can see here multi-nucleated तिम्रो neutrophils है, bone marrow biopsy मा पनि you can see है, यसमा नि cytoplasm र nucleus को चाहिँ asynchrony, you can see it in picture B. So treatment, folic acid may be administered orally or parenterally, 0.5 to 1 mg per day. If the specific diagnosis is in doubt, smaller doses of folate may be used for a week as a diagnostic test, because hematological response can be expected within 72 hours. Doses of folate more than 0.1 can correct anemia of vitamin B12 deficiency, but may aggravate neurological abnormalities. So in case of vitamin B12 deficiency, we have to give folic as well as vitamin B12. Folic acid therapy should be continued for 3 to 4 weeks until a definitive hematological response can occur. Maintenance therapy with vitamin is adequate, containing 0.2 mg of folate. Transfusions are indicated only when the anemia is severe or the child is very ill. Now coming to B12 deficiency or cobalamin deficiency, is synthesized exclusively by microorganism and human must rely on dietary sources, so animal food products, including meat, egg, fish, milk, for their needs. So unlike folate, older children and adults have sufficient B12 stores to last 3 to 5 years. In young infants born to mothers with